Today we're going to learn about how to use a netipot. A netipot is an ancient tool used in Ayurvedic teachings for keeping the sinuses healthy. And there are many times in our lives that we may have issues with the sinuses. It's one of the most common things that we'll see in a primary care physician's office. Obviously, the common cold is a cause for sinus conditions, also seasonal allergies, and just even the pollution that we're exposed to on a regular basis. So the dust and also just the car exhaust and other things that we're exposed to from day to day will cause some clogging up of the filtration. Some people also who have an imbalance in what's called kapha imbalance, they will have a chronic increase in mucus production on a regular basis, and that can cause problems with drainage and chronic irritation, which actually can cause a chronic cough, and also a lot of just sinus headaches and pressure and discomfort. If that mucus stays there and isn't cleared properly through the system, then we can end up with sinus infections, which is a really common issue that we see in our day-to-day practice in family medicine. So this tool, the netipot, is a very simple tool, a very simple self-care practice that you can learn. So we're going to go over that today so that you can learn how to keep the sinuses healthy and hopefully avoid sinus infections. So first we'll cover just a little bit of the anatomy about what is the sinuses, how are they positioned in the facial bones, and what role do they play in developing a sinus infection. We see a picture of the sinuses, and the purpose of the sinuses are to hydrate and warm the air as it comes in the body, and also to filter it as it comes in the body through the nose. We have frontal sinuses, which are here, ethmoid sinuses, which are here between the eyes, and most of us have had that experience of feeling pressure between the eyes when we have a cold or we're feeling uncomfortable from allergy symptoms. These have drain tubes that are at the bottom of the sinus, so when we're upright, they drain actually pretty well unless there's an obstruction there. And that's what we feel as postnasal drainage during the day when we're up walking around if we're having some issues with allergies or congestion or just excess mucus production. These are usually our trouble spots. These are the maxillary sinuses. They're in the cheeks, and this is the area where many people will experience a sinus infection after a common cold or from their seasonal allergies. You can see the main drainage hole for the maxillary sinus is actually up high. So when we're upright walking around during the day, this has to fill up all the way up to here before we really get much drainage from that. So that mucus sits in there all day. If we're in a dry environment, like an air-conditioned building, then that mucus tends to dehydrate and get kind of sticky and gel-like. Not a really pleasant thought, but that prevents it from draining properly. When we lay down at night, that mucus will tend to drain down the throat. So when we have a full sinus or that facial cheek pressure, when we lay down, then the body is in a position where the drain is able to work. And a lot of times people will experience that mucus running down the throat when they lay down at night. But what we'd like to do is to keep this moving through there and keep it from getting thick and sticky, help to keep it moving through every day so that there's not an opportunity for bacteria to set up and develop a bacterial infection in that sinus cavity there. And in order to do that, the netipot is very helpful because it actually helps us to get fluid saline solution into the maxillary sinus, thin out that thicker mucus, and allow us to blow it out naturally so that we're not retaining that all day long. So that's the purpose of the netipot, is to help us to irrigate the sinuses and to keep that mucus thin and moving, and help to keep it from sitting there long enough to develop an infection. So now we'll learn how to prepare the water. We need to make saline water so that it's safe for use in the nasal passages. To prepare the water for the netipot, it's really important that we're making sure that the water is sterile so that we're not introducing any bacteria into the sinuses. And we also want to make it saline, which means it's the same tonicity or the same salt concentration as the cells themselves in the body. So in order to do that, we just take regular tap water, or if you like, you can use distilled water or filtered water. But we always want to boil the water because that would make sure that we kill any organisms that might be present in the water that may have not gotten cleared out through the water treatment system. From the water itself is not saline, so we need to add salt, and we use sea salt. The reason for sea salt is that rock salt may have minerals in it that may not dissolve completely in the water. It's okay to use that, but then there can be a little grit left behind. And also the regular table salt has iodine added to it, And iodine, while it's a good mineral additive for our systems, if we put it into the sinuses, it'll burn. So we want to use the sea salt so it's more comfortable. So for 3 cups of water, we add 1 teaspoon of sea salt to our boiled water, and we just allow that to dissolve. And it's very simple. Just bring the water to a boil, add 1 teaspoon of sea salt for 3 cups of water, and then it's very important to stir the water so that all the salt can dissolve, and then we just store it in a clean container. And I think it's a great idea to just make this ahead and keep this in your bathroom so that it's cool. We never want to use hot water to use in the neti pot, so it needs to be room temperature. And I just store it in a clean, clear glass bottle, not plastic. It's better to use glass, and you can just keep that on your counter in your bathroom. So when you're going to use the neti pot, there are several different varieties of them that are available out there. This one is made from like a pottery. Just important to make sure it doesn't have any lead-based paint in it. And this one is one that you'll commonly find like in a Walgreens or any other grocery store, any other drugstore that has a lid on it as well. And some people find that handy because then the lid doesn't spill out of the top. So you just take your water that you've used, that you've made previously, and fill your neti pot with about a cup of water. And that will be plenty to irrigate both sides of the sinuses. When we do the irrigation, first we turn the head all the way to one side, and then we're pouring that water into the upper nostril. But it's really important to have the face turned downward so that maxillary sinus is tipped downward. That way we can actually get the water into the sinus cavity. If, as on our picture here, if we imagine turning the head all the way to the side, then we're pouring the water into the upper nostril. That then fills this lower maxillary sinus cavity. Once that is filled all the way, the water will come back up through the lower nostril, and you'll get some drainage of water out through that lower nostril. At that point, you know that a sinus is full. You can right the head and lean gently over the sink and just blow gently. You don't want to blow too hard because it can push a little fluid up into the eustachian tubes and kind of get a little popping in the ears. There's no harm if that happens, but no need for it either. And then we switch sides. So this time turning the head to the side, and this time pouring the water in the other nostril, which is now upward. So the cheek is facing downward, the ear is towards the floor, and we're filling that lower maxillary sinus with the saline solution just by tipping the tip of the neti pot into the upper nostril, pouring the water into the upper nostril. Once that lower maxillary sinus is full, we'll start getting water coming out through the lower nostril, and then we can right the head and gently blow through the nostrils as well. Sometimes it takes a little bit of adjusting. There may be a little bit of water that runs down the throat. That's perfectly fine, won't harm you at all. Just work on tilting the head until it feels like the water's coming out the lower nostril as opposed to going down the throat. And that's it. It's very simple, very, very beneficial to clear out any pollen, any sinus irritation that's there from viral infections, any just retained congestion that might be there. And it helps to keep that mucus from getting thick and developing into a bacterial sinus infection. So may save you a trip to the doctor, which is awesome, and keep you nice and healthy, keep you breathing naturally through the nose, and keep your body vibrant and healthy. So good luck.